Hey everyone, welcome to Nursing 101. Today, we're diving into the world of vital signs, focusing on body temperature. As future nurses, you'll be at the front line, measuring and interpreting these signs. So let's get started. First, let's talk about the different types of thermometers. Mercury and glass thermometers are traditional but less common now due to safety concerns. They can be used for oral, rectal, or axillary measurements, but are not recommended due to mercury exposure risk. Next, we have digital electronic thermometers. These are the most common for both home and clinical use. They can be used for oral, rectal, or axillary measurements, and are quick and easy to read. Tympanic thermometers use infrared technology to measure the eardrum temperature. They are quick and comfortable, especially for children, but can be less accurate if not positioned correctly. Temporal artery thermometers also use infrared technology, measuring the forehead temperature. They're non-invasive and quick, but their accuracy can be affected by environmental factors. Finally, non-contact infrared thermometers measure temperature from a distance. They're great for screening large numbers of people quickly, but may not be as accurate as other methods. Now let's cover the proper techniques for measuring temperature. For oral temperature, ensure the patient hasn't eaten, drunk, or smoked for 15-30 minutes. Place the thermometer tip under the tongue, instruct the patient to close their lips around it, and wait until the thermometer signals completion. Then, read and record the temperature. For rectal temperature, ensure privacy and explain the procedure to the patient. Lubricate the thermometer tip, gently insert it about 1.5 inches into the rectum, and hold it in place until it signals completion. Disinfect the thermometer thoroughly after use. For tympanic temperature, gently pull the ear back and up for adults or back and down for children. Insert the thermometer into the ear canal, press the button, then remove and read the temperature. For axillary temperature, place the thermometer tip in the center of the armpit, have the patient hold their arm tightly against their body, and wait until the thermometer signals completion. Then, read and record the temperature. Now let's quickly go over factors that can affect body temperature. Age. Older adults tend to have lower body temperatures. Time of day temperature is typically lower in the morning and higher in the evening. Physical activity exercise can increase body temperature. Hormonal changes, menstrual cycle, thyroid disorders, or pregnancy can affect temperature. Environmental conditions, extreme heat or cold can influence body temperature. Medications. Some drugs can affect body temperature regulation. Infections. Fever is a common response to infection. Metabolic rate. Higher metabolic rates can increase body temperature. And finally, here are the normal temperature ranges for different age groups. Newborns, 0-2 months. 36.6 degrees Celsius to 38 degrees Celsius, 97.9 degrees Fahrenheit to 100.4 degrees Fahrenheit, rectally. Infants, 3 months to 1 year, 36.4 degrees Celsius to 38 degrees Celsius, 97.5 degrees Fahrenheit to 100.4 degrees Fahrenheit, rectally. Toddlers, 1-3 years, 35.5 degrees Celsius to 37.5 degrees Celsius, 95.9 degrees Fahrenheit to 99.5 degrees Fahrenheit, orally. Children, 3-10 years, and adults, 36.1 degrees Celsius to 37.2 degrees Celsius, 97 degrees Fahrenheit to 99 degrees Fahrenheit, orally. Older adults, 65 plus years, 35.8 degrees Celsius to 36.9 degrees Celsius, 96.4 degrees Fahrenheit to 98.5 degrees Fahrenheit, orally. Remember, these ranges are general guidelines and individual normal temperatures may vary slightly. Context is crucial when interpreting temperature readings. That's all for today. Thanks for tuning in to Nursing 101. Stay sharp and